I'm Dr. Bill Sterett with the Vail-Summit Orthopaedics and Neurosurgery. We're going to talk a little bit about the differences in the female ACL. Why do they get hurt so much more frequently than our male counterparts? It's unfortunate, but there are some anatomic reasons why that happens, and I'm just going to teach you a couple of those that you can't modify. Inside the knee joint, here's the ACL. Stands for anterior cruciate ligament. You can see it in the front. What this ACL does is stops us from going too far forward like that. What you really need it for is it stops us from twisting. You can see as I twist all this shear strain that I'm putting on this meniscus. This meniscus is the cushion cartilage we talked about. If you beat up on that cushion too much without that ACL, eventually that cushion just goes away, and then you have this bone rubbing on that bone, which is called arthritis. So the only reason you need the ACL is to protect the cushion. The only reason you need the cushion is to protect you from arthritis. Let's figure out what are the things that all of our female athletes that I've been working with so strongly over the last 25 years, why they got ripped off a little bit. The ACL, for the same height and weight, you've got a 5'10" athlete that weighs 150 pounds, male or female. The female's ACL is about 30% smaller. Probably just has to do with evolution. Probably 3 million years from now, that's not going to be the case. If men were hunters and gatherers 3 million years ago, our females are kicking our butts in most of the sports now, so that's not going to be true forever. But for the same height and weight, the ACL is 30% smaller. What you see here, and hopefully you can see on this video, this little A-frame notch where the ACL goes through. In females, that notch is narrower. The way you were born with a narrower notch tends to pinch it with less twisting, like we were talking about, and all of a sudden that bony impingement will tear the ACL. So you've got a narrower notch, you've got a smaller ACL, and then the final thing is that hyperlaxity we focus on so much on some of these videos. Women have a much higher incidence of being loose jointed, meaning their knees hyperextend, meaning their elbows hyperextend, meaning they can touch their thumbs down to their forearm, they can bend their fifth finger back beyond 90 degrees, and when they put their palms or touch their toes, they can put the palms flat on the ground. If you meet 3 of those 5 criteria, you're loose jointed, and unfortunately that loose jointedness, that hyperextension of the knee is what helps pinch off that ACL from the bone on that same A-frame notch that we talked about. Increased hyperlaxity, narrower notch, smaller ACL are the non-modifiable risk factors that you can't get rid of, and it's just some of the reason we're going to have to put up with a little bit higher incidence. We're going to teach you some of the things that you can do to modify if you're a female athlete who unfortunately hasn't torn their ACL yet, and things that you might want to modify if you're watching this video because you have torn your ACL. But we'll go over all that. My team is real quick to respond. Feel free to get a hold of us on the contact information just below us. Love talking about this stuff, obviously, or we wouldn't be doing all these educational videos. I hope that helped this morning. I'm Dr. Bill Sterett. This is another one of your Sports Medicine Minutes.